Hello! Thank you for clicking this video. I am Justine and today we will talk about different bandaging techniques and how to properly perform them. Bandaging is an important skill in administering first aid. Bandages are materials primarily used to cover wounds, apply pressure, control bleeding, and support a sprain or strain. There are different kinds of bandages one can use. Some include grip bandages, triangular bandages, adhesive bandages, gauze, and special bandages. In addition to bandages, a dressing can sometimes be necessary if there are open wounds present. A dressing is a sterile pad or compress applied to protect the wound from infection and other additional harm. A dressing is designed to be in direct contact with the wound as distinguished from a bandage, which is often used to hold the dressing in place. In learning how to properly administer bandaging, it is important to know that there are different bandaging techniques you can use. Some include circular bandaging, spiral bandaging, figure of 8 bandaging, recurrent bandaging, and lastly, reverse spiral bandaging. In addition to bandaging techniques, there are also general protocols that one should keep in mind when performing bandaging to someone. First, make sure the person is comfortable and tell them what you're doing. Next, work from the side of the injury so you don't have to lean across their body. Next, keep the injured part of the body supported in the position it will be in when the bandage is on. Next, avoid covering fingers or toes when bandaging a limb so you can easily check the circulation. Next, apply the bandage firmly but not tightly and secure the end by folding it over and tying a knot in the end. You can also use a safety pin, tape, or a bandage clip. Lastly, as soon as the bandage is on, ask if it feels too tight and check the circulation every after 10 minutes. Now I will demonstrate to you how to properly apply bandages to 4 different sample injuries. First, an injury of the head with an open wound. Place an absorbent dressing on the open wound. Fold a large bandana-sized cloth into a triangle. Place it over the forehead of the casualty. Cross it once at the back of the head, bring around the front of the head again, and tie off. However, in my case, the bandana is too short, so I already tied it behind the back. Afterwards, tuck in bandages. Place hand on top of the pad and fit the bandage by pulling it at the back. Make sure the ears are not covered. Second is the fractured radius or lower arm. First, perform circular bandaging from the wrist to the hand. Next, wind the bandage in spiral turns towards the elbow. Make sure the entire forearm is covered with a bandage. After this, make sure the bandage is firm and not excessively tight. When you have reached the bandage end, secure the end by folding it over, or you can use a bandage clip or adhesive tape. Ask the patient if it feels too tight and check the circulation every 10 minutes by pressing on a fingernail or a piece of skin until it turns pale. the color doesn't return right away upon release, the bandage may be too tight, so you should loosen it. A bandana-sized cloth can also be used to support the forearm. Simply place the cloth between the arm and the chest of the casualty and tie the two ends of the longest side of the cloth at the back of the neck of the casualty. Make sure to tie the other end to fit the support to the injured arm. Make sure as well that the support covers the elbow up to the fingers. For the third sample injury, a broken finger. First, place a padding between the fingers. Starting at the base, wrap the gauze around the digits. Wrap it around 3 to 5 times. Use gentle pressure as you wrap the gauze without making it too tight. After bandaging, check that you still have good circulation to the digits. Again, press the tips of the fingers for a few seconds and then release. The last sample injury is the sprained ankle. First, elevate the ankle. Next, wrap the bandage around the ankle of your foot once. Next, pull the bandage diagonally from the ankle to the bottom of the foot's body. Now, bring the bandage diagonally to the top of the foot and towards the back of the ankle. Continue performing this figure 8 pattern until all bandage are used. Fasten the end of the bandage once done. You can fold the end or use tape to do this. Again, the wrap should be properly fitted but should not be too tight for proper circulation. First aid can save lives if administered correctly. By learning how to properly perform bandaging techniques, injuries can be prevented to worsen, pain can be alleviated, and and recovery can be faster for the casualty. Thank you for joining me in this video. Again, I am Justine. Stay safe out there. Goodbye for now.